Good morning, everyone, and thank you for joining us today to go over the protocols for OAS CAHPS and what to expect from this process. We're going to be led today by Jennifer East. Hello, that's me. I'm the project manager for the OAS CAHPS process here at the Jackson Group, and I have Janette Jones joining me. She's going to pick up a little later in the presentation to go over where we start talking about sampling and other protocols. But we're very glad that you've joined us today, and we hope this is an informative session for you. We will allow time for questions at the end of the presentation through the chat feature on your screen. You will be able to type questions, and we will do our best to respond today or get back to you or send out, the question and answer for everyone's questions at a later time. We are recording this process today, so we'll also have that posted onto our website. Should you have others that you know who wanted to attend but could not, we'll provide the recording along with the slides from the presentation to you. And we're going to go ahead and get started. The first slide would just basically be going over what we're going to cover today. And the purpose of the training session will be to, first of all, talk about the purpose and goals of the OAS CAHPS survey. We want to hit on the content of the questionnaire, and we do have a copy of that questionnaire that you can obtain from the website, or we can provide it to you. We will discuss just general information about public reporting, when that will start, what that will include, survey participation requirements for the HOPDs and ASDs, which we will define here in just a second. And then we'll also just go over what the OAS CAHPS survey web portal looks like, so you can see a few screenshots from their webpage and give you information on how to go in and get access to that data yourself. Let's start just with a brief overview of what the OAS CAHPS process is. Basically, the OAS CAHPS is a standard national patient experience of care survey, much like HCAHPS. However, the OAS is going to be surveying hospital outpatient and ambulatory surgery settings. Now, within the OAS CAHPS survey, we will be surveying two types of facilities. The first one is the HOPD, which I mentioned before, which stands for the Hospital Outpatient Departments. Basically, these are units of the hospitals with the primary focus being to perform outpatient surgeries and outpatient procedures. The second type of facility is the ASC, or Ambulatory Surgery Center, and this represents freestanding medical facilities that perform outpatient surgeries and procedures. So you have two types, one attached or related with the hospital outpatient department, and then another one, the Ambulatory Surgery Center freestanding facility. These facilities will report by CMS certification number, or CCNs, which you're probably familiar with if you're performing CAHPS processes already. Patients are eligible to participate in this survey if they had a surgery or procedure in a specified range of codes. And those are identified by what they call CPTs, or current procedural terminology codes, or also HCPCS-G codes. The next thing we want to discuss is just a brief overview of the timeline and how this process came about. In January of 2013, the call for measures for the process was issued, and in between 2013 and 2014, 6 focus groups and 3 rounds of testing were conducted. Then in August of 2014, a field test was conducted just to evaluate the survey instrument itself. And in February of this year, the survey was granted a CAHPS trademark. Then in July of this year, that survey was approved by the U.S. Office of Management and Budget, and there you can see their clearance number if you need that. And going on now, currently August through December 2015, there is a mode experiment being conducted. It's underway right now. And beginning in January of 2016 is when the voluntary participation in the OAS CAHPS survey will begin. It's important to discuss the OAS CAHPS survey development and how it will be used. Some of the main focuses of this process will be to produce comparable data on the patient's perspectives of care that will allow comparisons for those HOPDs and ASCs on domains that we feel are important to consumers. It will also allow for the creation of incentives for HOPDs and ASCs to improve their quality of care and what they provide through public reporting of results, and also to enhance the public accountability in healthcare by just increasing the transparency of the quality of care provided to patients. So much like the CAHPS process, they will have access, they being patients and the public, through the public reporting portal to view these results. The OAS CAHPS survey is conducted right now by independent approved survey vendors who are working under contract with HOPDs and ASCs. So those contracts obviously will take into effect beginning after January 2016 once this process becomes voluntary. Sampling and data collection are conducted on a monthly basis, and there will be 3 modes of data collection allowed for the process: the mail-only mode, the telephone-only mode, and also the mail with telephone follow-up of those non-responders. That's what they're calling the mixed mode. Some highlights of the survey questionnaire. The core outpatient and ambulatory surgery CAHPS document, or survey items, which you'll hear us refer to over the next few slides, make up questions 1 through questions 24. Some examples of the domains and the questions within that survey would be, for example, a domain about the facility and staff. One example of a question is, do the doctors and nurses treat you with courtesy and respect? Another domain regarding communications about your procedure. One question, number 9, did the doctors and nurses explain your procedure in a way that was easy to understand? And a new domain talking about your recovery for this portion. Did your doctor or anyone from this facility prepare you for what to expect during your recovery? They also have global rating questions like you may be familiar with through the regular HCAHPS process. For example, question 23 will also be using that any number from 0 to 10, 0 being the worst facility and 10 the best. What number would you use to rate your care from either the HOPD or the ASC? Also, question 24, would you recommend this facility to your family or friends? And there is an About You section as well within this survey, and that is comprised of questions 25 through 37. Some examples of questions within this portion of the survey would be, in general, how would you rate your overall health? Also, how would you rate your overall mental or emotional health? Additional About You questions that you can also see: what is the highest grade or level of school that you've completed? Are you of Hispanic, Latino, or Spanish origin? How well do you speak English? And did someone help you complete this survey? Facilities that are conducting other patient surveys during the same time as the OAS CAHPS are allowed to add up to 10 questions of their own to the OAS CAHPS survey. These additional questions just have to appear after the core OAS CAHPS questions, which again are those that are going to be questions 1 through 24. No changes are permitted to the core questions from the OAS CAHPS or to the About You questions. Currently, the OAS CAHPS survey is available in 3 languages: English, Spanish, and Chinese. The Chinese language is for male only currently. Now, what will the role of the HOPDs and ASCs be during this process? Communicating with patients is very critical to making sure this process is valuable and provides the results sought out. And it's very important that these HOPDs and ASCs avoid influencing patient responses to the survey in any way. Some things that are not allowed or not acceptable during this process would be sending or providing information to patients in advance, alerting them about the survey. It's not acceptable to provide a copy of the survey questionnaire or cover letter to the patient. It is also not acceptable to include words or phrases that are verbatim or taken directly from the OAS CAHPS survey in any marketing or promotional materials provided by the HOPDs or the ASCs. And also, attempting to influence patients' answers to the survey is also not permitted. Other things that are not allowed during the process: telling patients that the facility hopes or expects their patients will give them the best or highest rating, or to respond in a certain way to the survey questions. It's not permitted to offer incentives of any kind to the patients for participating or not participating in the survey. Do not help the patient answer the survey questions, even if the patient asks for the provider's help. And it's not permitted to ask patients why they gave certain responses or ratings to any of the survey questions. Finally, it's not acceptable to include any messages or materials promoting the HOPD or ASC or the services it provides in the survey materials, including mail survey cover letters, questionnaires, and telephone interview scripts. It is also not acceptable to ask patients if they would like to be included in the survey. As part of the process, the patients will be given an opportunity to decide whether they wish to participate based on if they end up in the sample. So there's some web links through the OASCAHPS.org site that will allow you to, first of all, go in and register on the private and secure side of the OASCAHPS.org. You will also contract with an approved OAS CAHPS survey vendor, and a list of those approved vendors will be available at that same website. This is also where you will authorize your approved survey vendor and also submit data, where we will be submitting the data for the HOPD or the ASC. And you will be compiling and delivering to your vendor each month a file with information about the patients served during the sample month. The HOPD's and ASC's role will also be to use a secure method to transmit the files to your survey vendor, ensuring that the data is encrypted prior to sending that information to your vendor. You will be working with your vendor to determine a date by which the vendor can submit the data to the OAS CAHPS Data Center. You'll also be monitoring survey vendor data submissions by reviewing those submission reports, and you'll see examples of some of these later in the presentation. And you can also have the opportunity to preview the public reporting of results. We're going to discuss survey eligibility now. Which patients are eligible to complete the survey? One patient requirement for eligibility is that they need to have had at least one outpatient surgery procedure in the sample month, and this includes patients admitted for observation. The patient must be at least age 18 at the time of the survey or procedure or older. They have to have a U.S. domestic mailing address, and the patient requirement must contain either a CPT code in the range that you see there, 10021 to 69990. That includes some procedures such as surgery, a diagnostic procedure, or another type of procedure such as an injection for pain management performed at either the HOPD or the ASC with no accompanying modifier of 53 or a discontinued procedure. Or the patient eligibility requirement must contain a G code of either G0104, 105, 121, or 260. Also, other eligibility, or who is ineligible, or should be excluded from this process. If the patient has had a procedure performed by the HOPD or ASC that is not appropriate for the OAS CAHPS, such as pre-admission testing, post-surgery follow-up testing, physical therapy, respiratory therapy, laboratory, or radiology testing only, those patients would not be eligible. A patient who is admitted as an inpatient following that procedure or surgery would not be eligible for this survey. If the patient is deceased, they're not eligible, or discharged to hospice. If the patient is living in a nursing home, they are not eligible to complete the survey. However, assisted living is eligible. If that patient has become incarcerated or they have chosen to have no publicity or requested that the facility not release their name, they're ineligible. And finally, if they've been included in the OAS CAHPS process within the previous 5 months, they will not be eligible in that sample month. And now Janette Jones, who is our consultant over and our Director of Patient Services here at the Jackson Group, will pick it up from here and start with the discussing of sampling.
Before we move on to sampling, if there are any questions that you have about what was just covered, please use your chat feature, and we will answer those questions before we move on. You can also ask questions during the process, and we'll answer them at the end. And so we'll wait a few minutes for people to ask some questions. We've gotten a few already. So I'll just wait a few minutes and let those compile, and then we'll address each question. So we have a couple of questions that we'll try to address. And if any time that you have an additional question, we'll also be providing our email addresses to you that you could email us directly if you need more feedback or have additional questions as a follow-up that you need. So the first question is, when you say that you are measuring perspectives of patients that we feel are important, have you gotten feedback from ambulatory surgery centers as to what is important to us? CMS actually, and I believe I'm understanding your question correctly, CMS actually developed this survey in conjunction with some WestStat and RAND, and what they've done is they have done pilot test studies that they do typically for all CAHPS survey processes before releasing it to be used by ambulatory surgery centers. So what they mean by when they say that they feel are important to ASCs, they start out with a much larger survey and do some studies on the questions and the feedback they've received from other ambulatory surgery centers. And this is through the Federal Registry question and answer process as well, where when the survey was initially released, they opened it up for comments through the Federal Register. So this is actually comments that CMS has comprised based on feedback from those different areas that they feel are important to the ambulatory to measure the quality of the ambulatory surgery centers. Next question is, it is my opinion that our response rate will decline significantly by increasing the number of questions to 27, plus our own 10, which would be meaningful to us. That is a valid concern. We do know from other CAHPS processes that it is possible. Really, the length of the survey is going to depend on the type of patient as well. It will take some patients longer to complete the survey than it will take others. Typically, 10 is the max. You don't have to add all 10, but you could add fewer than 10. You may also choose to add different things, to measure different things. What you would do is you would work with your survey vendor in identifying the 10 most important questions that you need to follow up the OAS CAHPS survey process with. And then from there, just monitor the process to make sure that it's not affecting your response rate. If you find that it is, then you would work with your vendor to modify that process and get you more meaningful data with a higher response option. And again, each mode of survey, each approved mode has different survey response rates. So it may be that where adding 10 questions to a telephone survey may not work for you, but maybe it would work with the mixed mode or with a written survey mode. So that's something that you can work with your vendor with and getting those maximum results for you. Will the current mode experience likely change the modes allowed and possibly add email? That is always a possibility. Those are typically what mode experience are measuring. Are other survey modes viable to this survey process? Will they be able to capture the same data, and do we have access to enough patient response methods to allow that as an allowable method? The answer to that question is, if it happens, it will probably be within a year or two. This survey actually goes live, meaning, well, not live, but will become mandatory in 2018. So the mode experience the mode experiments that they're doing now will likely adjust by 2018 if they were going to add any to the survey process. The next question is, will a proxy be allowed for this survey? No. The patient themselves must take the survey. There is a question on the survey that asks, did someone help you with the survey, and if what way, how? But that does not allow for a proxy. Patients can have people fill out a written survey for them as long as they've indicated that they've provided the answers to them for them, or if they have trouble reading, they could say, someone read the survey to me and I provided the responses. But having someone directly answer the survey for the patient is not allowed. Will you email out the slides as well? The webinar site is closed. Okay, someone's having technical issues. Yes, the answer is yes, we will. As long as we have your email address that you've provided, we will certainly email out this webinar presentation to you as well, and you can follow up, and you can ask us any questions that you need at that time as well. Another question we've received, will we have access to results if we don't participate? Not initially. There will be a publicly reported website, and that's once CMS has gathered 4 rolling quarters worth of data. So it's at least a year out, if not more. So you will have access to publicly reported data if you don't participate, but you will not have your own set of data to measure until that publicly reported data becomes available. And I don't think there's any additional questions. Okay, so we're going to go ahead and proceed with more of the process-related part of the survey. We'll start with the sampling process. Okay, so sampling terms that we use for sampling, as Jennifer went over before, HOPD or ASC, hospital outpatient departments or ambulatory surgery centers. The other term that we use for sampling is CCN. So if you get communication that asks for your CCN, that is your CMS certification number, which is given to all facilities that are approved to bill CMS for procedures performed. Your sample frame is the list of all eligible patients, and it will include all patients one time in that sample frame. The sample are the patients in the sample frame who are selected using an appropriate sample method for the survey, and that sampling method will differ depending on the setup of your ambulatory surgery centers or your outpatient departments. For freestanding, one location ambulatory surgery centers, it's a different process than if you have multiple locations throughout that are covered under one CCN for your ambulatory surgery setting. So there are different sampling methods, and that's something you will work with your survey vendor to determine which sampling method is appropriate for your process. And then the term sampling is simply the term used that we use to select the sample of patients that will be included in the survey process that we will actually be contacting either via written survey method, telephone, or a mixed mode. So your eligible hospital outpatient departments are hospital outpatient departments whose primary focus is to perform outpatient surgeries and outpatient procedures. CMS has defined eligible outpatient departments as units within the hospital which bill under the OPPS, also known as the Outpatient Prospective Payment System. The hospital also needs to be CMS certified and have a CCN CMS certification number that we covered with the previous slide. Some examples of those outpatient-focused units are same-day surgery and ambulatory surgery. Units that do not perform outpatient surgeries and procedures but are not focused on those procedures are not eligible. That would include departments of surgery, radiology departments, and emergency departments. So the important factor there of who is eligible is focused on surgical procedures. Outpatient-focused units that are within critical access hospitals are also eligible as hospital outpatient departments, even though those hospitals do not bill under outpatient prospective payment system. So if you're a critical access hospital that doesn't bill directly through CMS, you are still eligible to participate in this survey process. And there can be more than one HOPD in a hospital, and not every hospital has a hospital outpatient department that's eligible through this process. You would need to work with your survey vendor to determine the eligibility of your departments if you have any questions as to whether they would be eligible. That's something that your approved survey vendor who has gone through training and has access to the CMS guidelines can help you determine which of your units are eligible, if any. So to discuss, covering ambulatory surgery centers and their eligibility definitions. So your ambulatory surgery center is a freestanding medical facility that performs outpatient surgeries and procedures. CMS defines eligible ASCs as a distinct entity that operates exclusively for the purposes of furnishing outpatient surgical services to patients. The ASC must have an agreement with CMS and meet the general conditions and requirements in accordance with 42 CFR 416 subpart B. The ASC also has to be CMS certified and have a CMS certification number, or also known as CCN. The ASC may have physician offices on site, but it does not have to have any overnight patients, but it does not have any overnight patients. Some ASCs have more than one location, typically in a geographical region, and that's where we discuss, as long as they fall under one CCN, all of those locations under that CCN are eligible for that survey process. So the sampling processes, so facilities who are administering other outpatient care surveys that target the same population as outpatient ambulatory surgery CAHPS must follow these sampling guidelines. The OAS CAHPS survey sample must be selected prior to the samples for any other HOPD or ASC survey. That simply means if you are going to conduct an additional survey outside of the CAHPS survey process for your patients, we must select the sample for the CAHPS survey process before any other samples can be drawn for other survey processes. If the other survey is CMS sponsored, the facility must contact the OAS CAHPS survey coordination team to make arrangements for both surveys. And that is something that your CMS approved survey vendor can help you with. Vendors may not reveal to facilities which patients on the monthly patient information file were selected for OAS CAHPS. And because the coordination is necessary between all surveys must be done through a single vendor. CMS is targeting, as with other CAHPS surveys, a minimum of 300 OAS CAHPS completed surveys per year, or 25 per month. The sample size varies depending on the survey methodology used. The minimum sample size is 78 per month for mail only or telephone only, and the minimum sample size is 63 per month if doing the mixed mode. You may conduct more surveys, but you have to target a minimum of 300. So now we'll go through data collection and reporting. Data collection for the OAS CAHPS survey process must begin 3 weeks after the close of the sample month. And it must end 6 weeks from the initial mailing or first telephone attempt. That roughly means that once your month has ended, so if we start with January visits, the survey collection must start by the 21st day of February and then end 6 weeks after that, after that. It can start earlier, but it can start no later than 21 days after the previous month. Data collection should not stop for a given facility, even if the target number of completes is reached. So every sample member must receive the full protocol unless this case is finalized as complete and eligible or refusal prior to the end of data collection. So every patient pulled into that sample must be contacted, even if we've reached our target without having to have gone through the full sample. We must contact every person and give them an equal opportunity to complete the survey. So that follows the guidelines like as the other CAHPS processes. All survey activities are timed from the initiation date. Follow-up attempts begin 3 weeks after the date the survey was initiated, and data collection ends 42 calendar days after the date the survey was initiated. Unlike other CAHPS surveys you may be familiar with, proxy respondents are not permitted using any mode for the OAS CAHPS survey. And when they define a completed survey, it's defined as having completed at least 50% of all applicable questions to all sample members. So those sample members must have answered 50% of questions 1 through 10 and 13 through 24 in order to be considered a completed survey. Here we're giving you the OAS CAHPS website. This is where you will find updates about the OAS CAHPS survey process. Select your vendor. They also have training materials from the overall CAHPS training that your survey vendor would have gone through back in the end of October. But this is the site that you will use for all activities as far as selecting vendors, posting any questions to the OAS CAHPS survey team that you may have. And this is the website that your vendor also uses to communicate with the OAS CAHPS survey team and for submitting your data to CMS. Here's some screenshots of how the survey, the web page for OAS CAHPS surgery looks. So here you have the home page, and it will provide you with news, any news items, announcements. You'll see there's information there about the OAS CAHPS survey, about the national implementation, about the mode experiment, and then there's a registration and application process, and that's for survey vendors, and the online and that's for the online registration process for participating HOPDs and ASCs as well. Then you have a screen for general information. I'm sorry, to go back. You also have one for general information. There's training, and then there's specific tabs for vendors and specific tabs for facilities. So once you've acquired access to the OAS CAHPS website, under the Facilities tab, you will find all the information you need to get up and running with this survey process. So facility users can access private features of the website specifically designed for the tasks they must complete. Access starts by completing the facility registration, which creates a unique login credentials, and that's for the website. If you noticed on the previous screenshot, there's a login page up in the upper right-hand corner. You will need to log in and get your login credentials in order to access the For Facilities tab on their website. Upon completion of registration, facility users are directed to their custom dashboard, and all major features are available from the facility dashboard. Here's a snapshot of what the dashboard looks like. The check marks next to the items indicate that part of your process has been completed, and then any other statuses would be, as there you see 0 CCNs already registered and 0 CCNs have current authorization. So those are still pending. And then the resource tab will show you, will give you all the information you need. If there's a form you need to download or training information that you need, it provides you with that. And then it also tells you who has access to this website. The role of the HOPD or Ambulatory Surgery Center survey administrator includes completing the CCN registration form, designating backup survey administrators, authorizing a vendor to submit data on your facility's behalf, and serving as the main point of contact with the OAS CAHPS survey coordination team. That main point of contact will get any email from the OAS CAHPS team. It will all coordinate through that main point of contact that you identify on when you sign up on the OAS CAHPS website. The HOPD or ASD survey administrator is responsible for designating another staff member as a backup administrator, setting up each backup administrator via the managed user console, which is maintaining, updating the list of backup administrators, removing staff who no longer need access, or adding any new staff to that needs access. Vendor authorization. You'll use that tab when your facility needs to contract with approved vendors. And again, this survey process can only be conducted through an approved vendor, and those vendors are identified on the OAS CAHPS website. You will receive a full list of approved survey vendors. The Jackson Group is an approved survey vendor. Facilities must also authorize vendors to submit data on their behalf. So when you authorize your survey vendor, that allows your vendor to submit any data collected directly to CMS on your behalf. Vendor authorization menu, you start an authorization, you delete an authorization, or you get your authorization report from that menu. And only approved survey vendors are authorized to submit the data, as I mentioned before. To authorize a vendor for your OAS CAHPS survey process, you need to select the vendor from the drop-down list provided on the OAS CAHPS website, select the start date for the authorization, select each facility or CCN for which this vendor is being authorized to submit data, and then submit that form. If you have questions about start date, your vendor will be able to help you identify which start date is needed for that authorization. And this is a screenshot of the data submission process. This is what your survey vendor will use to submit your data once all data has been collected for the time period, for the quarterly time period or monthly time period, however often your vendor updates. When you authorize your vendor, make sure the start date is on or before the date of the first sample month the facility begins its participation in the OAS CAHPS survey process. Vendors can only be changed at the beginning of a quarter. So once you've started collecting data for the first month of the quarter with one survey vendor, that survey vendor must then collect the other 2 months within that quarter, and then you can change vendors at the start of the next quarter. There can be no overlap between vendor authorizations. So even if you're switching vendors, you need to work with your current survey vendor as well as your new survey vendor to ensure that each vendor will be allowed to submit data at the time that they need to submit data. But you will not be allowed to authorize 2 vendors at one time for your facility. You may only have one active survey vendor at a time. This authorizes your survey vendor to submit data, not conduct the survey. When switching between survey vendors, there could be periods when both vendors are conducting the survey. So again, if you find yourself in that scenario, you need to contact your current survey vendor to identify what needs to be done to ensure that all your data gets submitted successfully. These are your data submission deadlines, and this is simply just a reference for you. This is, again, your survey vendors will be doing this on your behalf. This is just to give you an outline of when that will happen. So all data collected for quarter 1, 2016, that's January through March of 2016, all that data is due to be submitted no later than July 13th, 2016. And then you can see for subsequent quarters, we will be uploading in October, January, and April. January of 2017 and April 27 to close out 2016 calendar year data. That final data for all of calendar year 2016, that last bit of data for quarter 4 will be submitted to CMS in by April 12, 2017. So where someone had that question before about will data be available if you don't participate, these first 4 quarters are the first 4 quarters that CMS will have available on that publicly reported website. So you can see that we don't submit that data until April 2017, so we're at least a year, we're more than a year out from having that data available online for public and those who don't participate in the survey process to view. And CMS does update that once they update the website, it'll be updated on a quarterly basis for public viewing. Your data submission report. The intent of this report is to allow facilities to monitor the data submission activity. And the report lists dates for which the vendor has submitted data to the OAS CAHPS data center for a given facility. Only data that has passed both the immediate and overnight edit checks will appear on this report. So you will have access to your data submission report so you can actively see the activity of your survey vendor uploading your data. And this is the data submission report. That's a snapshot there. If you find that you do not have access to the screen, contact your survey vendor and they will be able to send you a confirmation report. They will get those confirmation reports directly from this website. The public reporting that we talked a little bit about, what will be publicly reported? CMS, once they've publicly reported this data, it will be listed in composite measures. So you will receive outcomes on the publicly reported website about the composite measures about facility and staff, communications about your procedure, preparations for discharge and recovery. And then the other reported measures will be your global measures, which are your overall rating of the facility, which is on a 0 to 10 scale, and the willingness of the patient to recommend the HOPD or ASD to family or friends. So you'll have those five measures reported when it's available on the publicly reported website. Beginning in January 2016, OAS CAHPS will have voluntary national implementation. Ratings of HOPDs and ASDs who elect to participate in the voluntary national implementation period will have their data publicly reported beginning with data collected in the 3rd and 4th quarter. At this time, there is not a final rule regarding the annual payment update. So the first public reporting of the OAS CAHPS survey data is anticipated for January 2018. So we're still 2 years out from that. It will represent surveys from patients in sample months July 2016 through May 2017. That begins with your quarter 3 data. Data from patients in sample months January 2016 through June 2016 will be available to facilities but not publicly reported. Results are not publicly reported for an HOPD or ASD until that HOPD or ASD has 4 quarters or 12 months of data. And data are uploaded quarterly, with the earliest quarter being replaced by the data from the most current quarter. So it's a rolling database that CMS maintains. Prior to publishing the results on the CMS website, the OAS CAHPS Survey Coordination Team makes available a preview report posted on the OAS CAHPS website so that each HOPD and ASD can review the results that will be publicly reported. 2 weeks after the preview report, results will be published on a URL within the CMS website. And they'll announce that exact website in 2016 where you can review that report. Okay, we've come again to the questions part of our presentation. So if you have any questions, please use your chat feature or your questions feature to submit your questions. Okay, what about 23-hour stay patients we have these at our ASC? That's a good question. CMS does say it requires an overnight stay. Right now, the way they determine an overnight stay is the date that's listed as the start date of the visit and the end date of the visit. So if that end date is within 24 hours, then it's still submitted. But it's
they don't. It's just overnight.
Right. It doesn't include the overnight. So if you have a start date on one day and an end date on the next date, that is not eligible. It's all dependent on the start and end date of the procedure. We will send out this presentation. If you have any questions that you think of after this presentation ends, please feel free to contact us via telephone. Our phone number is listed there. Or you can email me. I'm Janette Jones, Jennifer East. Kyle Ward is another person who's you may email to get information about this. We can provide you with information. We can also, if you'd like access to the CMS web training slides, we would also be happy to provide those to you. And that concludes our presentation. We're going to go ahead and hold this up for a few more minutes to allow anybody who still has questions or wants to copy down the contact information, and we will end the presentation within the next few minutes. So if you have any questions, we'll stay on the line for just a little bit longer, but if you don't have any other information, you may go ahead and disconnect at this time. Thank you.
Thank you for your time.